Hi Ramona, it is a privilege talking to you. We're talking today about joint pain. All joint pains aren't the same. How do I distinguish between inflammatory pain versus a mechanical pain or a joint pain that I need to give more attention to?
It's a pleasure to be here, and this is an important question, I feel, especially given that this helps us to determine what type of an arthritis a patient has. So with the mechanical pain, is more related to use of the joint. So the patient experiences pain and stiffness while moving the affected joint, and it then subsequently improves when they rest that joint. And this suggests a more degenerative type of arthritis, like an osteoarthritis. In comparison, an inflammatory type of pain is a pain that occurs at rest and is associated with more marked stiffness, usually more than 30 minutes, and usually occurs at the morning or at rest. And this pain then subsequently gets better when the joint is moved. This suggests a more inflammatory type of arthritis like rheumatoid arthritis and psoriatic arthritis.
But we can get an inflammatory arthritis that involves only one joint, like gout or septic arthritis.
Yes, for sure. So you can get an inflammatory type of pain, which we call sort of a monoarthritis, which can be more of an acute arthritis rather than a chronic degenerative type of arthritis.
Does my diet play a role in joint pains, in arthritis?
Yes, so what we know is that eating a healthy diet helps to fight inflammation and joints and improve fight inflammation in joints and improve joint pain. And what we've seen is that essentially diets rich in fruits and vegetable, as well as legumes and beans, as well as fish, sort of a Mediterranean diet, has a healthy impact not only on your cardiovascular system but also in decreasing joint inflammation activity. We've also recently learned that there's certain food triggers that can trigger inflammation, sort of like your refined foods, your starches, as well as your refined sugars and additives like monosodium glutamate or MSG, which then essentially triggers inflammation and can worsen one's pain.
Red meat, if I do a high protein diet, does that put me at risk for certain types of arthritis?
Yes, so especially with patients with gout, we do know that certain foods that can also trigger gouty episodes, where like red meat or especially, like I said, the refined sugars, cool drinks, things like that can also play a role in triggering these episodes.
You already discussed the role of diet, but does my weight play a role in how I experience joint pain?
So basically, being overweight itself is a risk factor for especially osteoarthritis, and we know that there's two mechanisms which can cause this, and the first one being actual direct pressure on the joints. So just being 4 kgs over your normal body mass incurs about 6 to 20 kg, between 6 to 20 kgs of weight on your, especially on your knees, which can basically then increase with certain movements like going up and down the stairs, or even squatting up to picking up objects. And this increased pressure over a sustained period can then lead to osteoarthritis and can actually worsen your pain. The other second mechanism that weight can play a role is that fat itself is a chemically active tissue, and that can cause inflammation. And this consistently low grade of inflammation can lead to osteoarthritis, and worsen your pain as well.
What can I do to protect my joints, except for losing weight and eating the right foods?
Yes, so that's actually a great question, because it's actually simple measures that one can take to protect their joints. And first and foremost is also, like we said, maintaining a healthy weight to decrease pressure on your joints, and also keep moving, stay active. This helps with decreasing joint stiffness. And we know that low impact exercise like swimming and stretching also increases your range of movement of your joints without putting undue pressure on it. Also, like we said, maintaining a healthy diet. Don't forget foods with high calcium and vitamin D, because this can prevent osteoporosis. Using a correct posture when you're sitting and standing basically always beware when you're picking up heavy objects. I mean, if you can, rather slide the object than actually pick it up. But if you are going to pick up heavy objects, use your large joints, especially your palms or your arms, rather than your small joints, which can be affected by your arthritis. And lastly, highly recommended is to stop cigarette smoking, because we know that cigarette smoking itself is a risk factor for conditions like osteoporosis. And if you're genetically predisposed to inflammatory type of arthritis, like rheumatoid arthritis, this can be an issue and worsen your inflammation.
How long must I wait before I go to see a doctor because of my joint pain, or when must I consider surgery or replacement of a knee?
Okay, so I think the first is the main question to ask yourself is your joint problem and arthritis? And that's what we worry about. Like in rheumatology, our main concern is your joint pain and actual arthritis, because we know that if you left untreated, your joint pain your arthritis can worsen and lead to joint damage. So we look for signs and symptoms that are highly suggestive of an arthritis. And this itself you can see as well. This is a painful, swollen, stiff joint. Can be one or more joints. These joints are warm to touch. It's difficult to move. You're unable to move to perform your daily activities. And if you see that you are having these swollen, stiff joints, especially with an inflammatory type of pain, this is definitely something you should go in and seek medical help. When it comes to surgical options for your joint surgery like knee and hip replacements, they are options, or they form part of our management repertoire. So especially in patients who have destroyed joints or are in extremely severe pain. But I think the most important thing to consider when you're considering surgery is to know that this is not a cure for a degenerative or progressive problem. Even with surgery, you'll still have to maintain a healthy weight. You'll still have to keep strong and basically take your medication. But like with any medical intervention, I mean, surgery, there are pros and cons. So the pro being that, one, the joint surgery will help a lot of pain, and that's the primary driver of why people seek joint surgeries, and it also improves the level of activity. But on the other option, the cons are that you need to take into consideration that it is surgery. So there are risks to surgery, especially if you've got comorbid conditions. There are intraoperative risks. There are risks post-operatively with infection, with clots, and these are things that you need to discuss. You also need to know that once you had joint surgery, you need to commit to recovery and a rehabilitation program. And there is an option for revision surgery or a second surgery if there's failure of the implant. And so these are the risks that you need to discuss as a doctor, you need to discuss with your patient to tailor make a program or a treatment plan that is good for them.
Ramona, is it safe to put a needle into a swollen joint, to aspirate the joint?
So actually, if you had a arthritis, an acute single joint arthritis with swollen, it definitely is okay to put in a needle. We aspirate the joint. I mean, the main thing to do is to rule out an infection in that joint, and we want to make sure that there is no actual pus in that joint. And then if there is no pus, then we take the fluid, we can send it off for analysis, we can send it off for crystals, decide if that's a gout type of fluid, is that an inflammatory type of fluid, and it actually helps us with our diagnostics.
And if it's a septic arthritis, that's the one form of arthritis that we can't afford to miss or not make the proper diagnosis, because that will lead to acute destruction of the joint.
Yes, it is. So septic arthritis is definitely a medical emergency, and that's something that, like you said, you need to put in a needle in the joint and rule out, because that would require. We know that taking antibiotics either orally or through the veins is not going to manage that type of arthritis. It's not going to get to get out that infection. The only way to get out that infection is to physically remove out the pus, which will need an orthopedic doctor as well to do a washout of that joint.
Ramona, thank you. The information was extremely insightful and very helpful. Thank you.